Hi, my name is Coach Munene. On this episode, I'll be talking about seniors medical cover. I think in the last couple of weeks, one of the most requested or asked about topic. So what is a seniors medical cover? Ideally, as the word suggests, seniors wazee, okay? People who are aged between age of 60 to 80. So it doesn't mean that if your parent is on the cover and turns age 81 that we drop them from the cover. No. It simply means that we allow new joiners, people who are applying for medical cover, people who are aged between 60 and 80. So your parent is 75, your parent is 79, they can still apply and be enrolled into a seniors medical cover. And they will be covered for the rest of their life. So when I say between age 60 and 80, it does not mean, please get this right, that we are going to drop them at any point in time. No. They are covered for life. Okay, so when they're hitting age 80, when they're celebrating a big milestone, we are not there sending them non-renewal letters. No, we are actually still inviting them for renewal and continuing their cover until the day the good Lord Almighty calls them to himself. So that's the age limit between age 60 to 80. So it means if you're applying for cover and you're age 81, most senior medical covers will not allow you to join. They'll not you can't even get a quote. Let's begin there. Okay? However, there's a cover that I only know that allows up to age 100. And if you want more details about that, the number is down on the screen. Talk to Coach Munene. Let's have a discussion. What is covered in a seniors medical cover? Okay, I get that question a lot. The truth of the matter is that a seniors medical cover is very similar to the other regular medical covers. It's just that it is designed specifically, uniquely for the elderly, for the old-aged people. Okay, because kitambo, back in the day, most covers would terminate at age 65. You would not get a cover in the market for people above age 65. Okay, so what is covered is admissions. Admissions are covered. Hospital admissions are covered. Bed charges. Okay, a bed charge can be quite expensive. We're talking about 12,000 to 15,000, even above, for a standard private room, a room with a toilet and a bathroom. You know, private. It's just you yourself admitted there, not a general ward where everybody is sharing common amenities. Okay, so it ranges from about 12,000 all the way to 18,000, depending on the hospital that you choose. So there you go. Bed charges are covered. It covers doctor's fees, nursing fee, anesthetist fee. Forgive my Mount Kenya accent. It covers admission to HDU, admission to ICU. It covers major surgeries like organ transplant, knee surgery, hip surgery, gynecological surgeries like fibroid removal, or even hysterectomy. It covers admission for chronic ailments. You name them: arthritis, diabetes, hypertension, thyroid. It even covers referral to places like India. If your parent needs to be taken to India for treatment, whether be it cancer, be it a surgery, it will cover for treatment outside of Kenya. So it is it's a comprehensive medical cover, covering all this and other benefits like home nursing. If your parent needs to be taken care of at home, the doctor says no need of having them in hospital, let them be taken care of at home. Home nursing is covered. So it's a very comprehensive cover. It covers my favorite benefit, which is the health checkup benefit. Okay? And I always advise people, even if you don't have a medical insurance cover, get a health checkup every year, especially for your parents. Yeah. And we'll even show you which company actually even gives the highest health checkup benefit, because you need higher limits for health checkup. They need to check everything, every organ, from the heart to the kidney to the liver. Every organ needs to be checked. And therefore you need a health checkup benefit that is adequate and sufficient. Okay, I digress. Let me go back to the topic. So why do you need a seniors medical cover? Munene, why do I need a seniors medical cover? It's because peace of mind. I've been in this industry for long enough to tell you there's nothing as peaceful as knowing your parent has a card. If they ever fall ill, it's just to take that card, present it at any hospital near them, get treated. There's nothing as stressful as being in a meeting, being called by your parent because they need money to go and be treated, and you cannot answer that call because you're in a meeting. Okay? And even getting out of that meeting and being told, by the way, XY, we need 200,000 shillings. It's the middle of the month. You're being told they need 200,000 shillings to admit your parent. There is nothing more stressful than that. Number 2 reason why you need it is because it's affordable. You and your siblings can put yourselves together and purchase a medical cover for your parent. Okay? You can put resources together and purchase a medical insurance cover for them. It's annual. We pay it annual. You can also do monthly payments. So nothing stops you from doing monthly payments. I think up to a maximum of 6 months. You can actually pay up to a maximum of 6 months. Pole, malipo pole. So it is affordable. It gives you a peace of mind. They took care of us. We were the responsibility for a very long time. Now it is our turn to be responsible and take care of them by taking a medical insurance cover in their name. Lastly, medical expenses become more expensive as you age. The older you become, the more expensive it is to treat. And unfortunately, I don't know why, as people age, then this diseases starts cropping up. This diabetes, this hypertension. So you start seeing, oh, she's complaining about arthritis, she's complaining about her knee, and treatment is not cheap for the elderly. I know a couple of families here in Nairobi paying Kenya shillings 30,000 per month on medication for their parents. And lastly, I get this question a lot. How much is it? How much? And it's a very important question. But the answer is this. It depends on 3 things. Number 1, it depends on the age of your parent. Your 60-year-old parent is not paying the same premium as my 67-year-old parent. Okay? I'm paying more than you are paying. Your 80-year-old dad is not going to pay the same premium as your friend's 70-year-old dad. So medical insurance is age-based. It depends on the age of the individual purchasing the medical insurance cover. So there's no one price fits all. Number 2, it depends on the benefit that you choose for your parent. So if you come and tell me, Munene, I want a 5 million cover, you will not pay the same premium as somebody who came and told me, I want a 1 million cover for my mom. There'll be a difference in pricing. 5 million benefit versus 1 million benefit. So the more the benefits, the more expensive it becomes as you load up the benefits. Okay? Then number 3, if you have 2 parents, you'll not pay the same premium as somebody who has 1 parent. Comprende? 2 parents obviously will be more expensive than 1 parent. Okay, so it's not like when you walk into a supermarket and you pick a tray of eggs and you see the price tag there is 500 shillings. No, medical insurance is based on the age, the benefit you choose, and the family size. How many are you? So if you have 10 children, you definitely know you pay more insurance than a person who has just 2 children. Okay, so that is how it is calculated. And I'll ask my producer to actually put something down here, like an example. It's an example of how much you would probably pay if your parent is between age 6 to 65, 7 to 75, just as an example for us to see if you pick a 1 million benefit, a 2 million benefit, how much would it cost us? Just as an example. It doesn't specifically mean that is what you will pay. So if you want to get a personalized quote for your parent, then use the link that is going to be left here, where you'll give us the details. So, for example, the name, you'll give us the age and the benefits that you want your parents to enjoy. And then the system will calculate for you a personalized quote and send it to you based on the specifications you'll put in the link that is down below. See you on the next video.